Here I am. I'm Dr. Gail Randall, and I'm here for my 6 o'clock Instagram TV on Be Happy, Balance Your Hormones. I'm a board-certified internist, gastroenterologist, integrative medicine doctor, and functional medicine doctor. I treat a lot of things through the gut, but hormones are an important piece, and I haven't spoken about that, so I thought we really need to talk about it. Hi, Alex. So let's do that today. What are hormones, anyway? Hormones are chemical substances, kind of like, well, they are neurotransmitters as well, that act like messengers that'll travel from the site, the gland, or wherever they're made, to the tissues that are their targets. And they affect a specific action on those cells that are waiting for them to arrive. Different types of hormones are insulin, so that's like essential for your metabolism and how you process sugar. Melatonin, which is essential for sleep and other nervous system things. Estrogen and progesterone, which are primarily women hormones, but men also have estrogen. And testosterone, which is in both women and men. A lot of people don't think about women as having testosterone, but it's a very important hormone from them. And cortisol, which is, of course, in both sexes. And in this day and time and COVID and all we have going on, you know, cortisol is a big deal because cortisol is what goes up with stress and anxiety. And we've had a lot of that. You know, not being able to go out, wearing masks, everything changing. It's been difficult for people, and that, you know, raises your cortisol level. I mean, life is stressful enough. And that cortisol spiking was initially a protective thing, because cortisol is a protective hormone in a small amount. But then when it's constantly elevated, it bathes your cells, you know, like being on prednisone or something. It dysregulates your metabolism, can raise your blood sugar, can raise your blood pressure, can be hard on your brain. A lot of things about cortisol that we need to think about. And so we need to do things to keep ourselves out of the stress stream. That's what I say. So meditate, do breathing. I like to teach this 5-minute method of breathing where you breathe in through your nose for a count of 5, breathe out for a count of 6, allowing your belly to rise with the breathing in, and just allowing it to go down when you breathe out. If you do that for 5 minutes, research has shown that it will slow down your brain waves, it'll lower your cortisol and other stress chemicals in your body, and it will stay that way for 6 hours. 5 minutes for 6 hours, you know, even simple math or easy, you know, simple business will tell you that's a good deal. So that is one thing that we can do. It's like reaching out, finding your own stress rheostat and turning it down. We need to do that. I tell people twice a day because life is stressful. It's just part of it. So, you know, on another note, we are living longer, but our quality of life has not really improved. The World Health Organization ranks the United States 35th in life expectancy in comparison with 200 other nations. I mean, we spend almost 20% of our gross national product on health, or our GDP, our gross domestic product, I guess it's called, on health, 20%, and we're not really seeing any improvement. We get older, we all do this, we look in the mirror, we see that little extra fat around our waist, we go close to the mirror, we say, starting to get some wrinkles or getting more wrinkles. And, that wouldn't be so bad, but we don't feel well. Why? Why don't we feel well? The Mayo Clinic proceedings reported that 1 in 5 people in the United States are on 5 or more pharmaceuticals, big pharma for pharmaceuticals. That's a lot of drugs. Those drugs have side effects. And if you still feel crummy after being on 5 pharmaceuticals, something's wrong with that picture. Why do you still feel bad? And this goes for men and women. And this talk is not just for old people. People's hormones start going down in their 30s. We don't feel it. We don't really notice it. It happens slowly. And then suddenly you find yourself in your 40s and your 50s and you can't sleep. Or your libido is falling down. Or other things. Maybe you're losing some muscle mass. These are all could be hormonal things. And you should go to your doctor, or a doctor like me, who's going to measure your hormones and treat your hormones and not give you something else for your symptoms. So, for example, all these scientific advances in medicine does not seem to work for us. We're taking all these medications and people are still dying at the same rate or increased of heart disease, stroke, diabetes, chronic lower respiratory infections, cancer. These are all inflammatory diseases, Alzheimer's and diabetes. I said diabetes, influenza and pneumonia. So why is that happening, and why aren't these medicines working? Well, because we're treating the symptoms and not the disease. And really, heart disease, stroke, cancer, well, maybe not cancer, but perhaps, because that's an inflammatory disease, heart disease, stroke, and Alzheimer's disease and diabetes are pretty much all the same disease. They're lifestyle diseases. So if we're eating the way we're eating, which is not good, the standard American diet, the SAD diet, which is full of non-organic meat, processed meat, full of sugar, that's going to make you sick. And we're not exercising as much as we should. We're not meditating. We're not praying. And we're eating this bad food. So that's what causes it. All the vast amount of Alzheimer's is on the climb. All these medicines are on the climb. Diseases are on the climb. Heart disease on the climb. Strokes on the climb. Diabetes super on the climb. I think there's 340 some million people in the United States now with diabetes. That's a huge amount. What is wrong? Well, what is wrong is our food and our lifestyle, and it can be changed and it can be fixed. Obesity plus overweight is up to 60% in the United States. That's a marker. The people that got admitted to hospitals for COVID were pretty much the majority all overweight and had low vitamin D levels. So there's a little key for you. Vitamin D does what? It lowers inflammation. And obesity does what? Causes inflammation, or they are inflamed. As I mentioned, the food and the lack of exercise causing inflammation in their bodies. So the medicines are treating the symptoms and not curing the diseases. That's the problem. That's why we still feel crummy when we're on all these medications. And medications have their own side effects too. So getting back to hormones, or let me just say this too. We have 37.2 trillion cells in a human body. 37.2 trillion cells. And our health is really a result of what we soak those cells in. What do we give them? Are we giving them clean, organic food, lots of fruits and vegetables, and primarily plant-based, and the meat that we do eat is organic, grass-fed? Or are we going to McDonald's and eating? You know, there's a difference. You know, that McDonald's may taste good. You may think, oh, this is great. It's not great. It's not great at all. So that's what's going to soak your cells, because those foods at those fast food chains are full of herbicides, pesticides, and fungicides. And glyphosate, which is Monsanto, is in that category, is well known to be associated with gut problems, which causes inflammation, which causes cognitive decline, which causes heart disease, which causes stroke. So these chemicals cause the diseases as well. That's why we need to eat cleaner, and we need to eat things that clean us out, which are vegetables and fruits. And also soaking your cells in it's not just food and exercise, it's also spiritual, and it's also, you know, good energy. You know, what do you do, what do you do for, you go to nature and soak in the energy? Do you spend time with your friends and your family? Or are you constantly worried and ruminating about things? Or are you, you know, playing computer games all the time? You know, those are the kind of things that aren't going to be healthy for you. Going to nature, going for a walk, spending time with your family and friends, that's going to be healthy for you. So what are you soaking those cells in? Because that's ultimately what's going to determine your overall health. It's lifestyle. So are your hormones, which leads me to, are your hormones contaminated with toxins from your food or your environment? That's what I referred to before. That's the herbicides, pesticides, and fungicides, which are very potent neuroendocrine disruptors. Those chemicals bind to your hormone receptors, this is men and women, way, way, way tighter than your natural hormones, and your natural hormones don't have a chance, can't even get there to do what they need to do. This is what's causing prostate cancer, this is what's causing breast cancer, and so what we need to do things to knock those things off are receptors. That's lots of organic fruits and vegetables, maybe using a Vitamix or a Ninja or something like that to juice greens, green leafy vegetables. If you DM me, I'll send you my recipe for the best green drink you ever had. Comes from my Randalls Rainbow Detox formula. So also these chemicals will cause, like for a woman, it'll cause her premenstrual syndrome. You know, in many countries that eat cleaner than we do, they don't even have premenstrual syndrome, or they don't even have menopause as bad as we do, because it's from the chemicals blocking the receptor sites in our bodies. And that's why men now are getting low testosterone very young. Very young. I mean, starting in their 30s, they'll start to have their testosterone go down. And then their libido goes down, and their motivation goes down, and they don't feel like working, and they don't feel like doing a lot of things, so, and they get depressed and anxious. You know, men are simple. They have a hormone for the most part. Yeah, they have a little estrogen, and yeah, they have a little of this and that, but mainly it's testosterone. And if they're depressed, I'll check their levels if they're depressed. And more often than not, they'll be low. And then when you give it to them, it's like an antidepressant for men. It's huge. So you need to go to somebody that can recognize these things. If you feel crummy, I mean, what I see over and over again is men and women, and particularly women end up on more medicines than men, will go to a doctor, and this happened recently, like a woman in her 40s goes to her doctor and says, I'm having hot flashes and not sleeping well. Well, anybody that knows anything about menopause or hormones knows, and my menstrual cycle stopped. That was the other clue. And so what did he give her? he gave her Effexor, which is a really potent antidepressant. And she originally saw him for high blood pressure. So Effexor also has the potential to raise your blood pressure. So she's going for menopause symptom and she gets an antidepressant. That's just so classic for Western medicine. I mean, it's not the treatment. You're right, Alex. One of the best ways we can save more lives is by exercising and growing more plants and organic foods. 100%. 100%. Okay, so are your hormones contaminated with food, with these chemicals from your environment? So go check it out. Go to a doctor and they can help you. Also, do the detoxification. Eat lots of organic fruits and vegetables, and it actually will knock it off your receptors and help you out. A lot of women have hormonal imbalance, and men, and they don't even realize it. They just think, oh, I'm getting old, or I don't know what's wrong, or I'm working too hard, and these symptoms are masked by the medications that they're given by their doctors. So they give them, these antidepressants, which sort of flatten them out. They feel less bad, but they also feel less good. You just feel less. And they're gaining weight. They're not sleeping. And I'll see this over and over again where women get diagnosed with chronic fatigue. Chronic fatigue or fibromyalgia, and then they get on a bunch of drugs for that, when in fact, what they really need is to have their hormones checked out, and maybe they need some. Women get hot flashes, night sweats, unexplained weight gain, mood swings, sleep problems, vaginal dryness, decreased libido, and brain fog. Men get fatigue, decreased libido, depression, weight gain, lack of motivation, and brain fog. Does it sound familiar? If you suffer from these symptoms, you really need to consult an expert like me and somebody that'll really address your hormones and not just toss some kind of sedative medication at you, which is just going to make you worse and just cover up the symptoms. You may also need dietary advice, as we've been alluding to, and one of the listeners brought up. You may need to detox your hormones from the herbicides, pesticides, and fungicides. And those things are very potent carcinogens as well. So, but you can't stay away from them. They're everywhere in the environment. I mean, I was shocked. I eat more pure than just about anybody I know. And I did a glyphosate level on my urine, and I was shocked to see that I had it. Not very much, but I had it. So it comes through the air, comes through the water, and so you just have to do everything you can on the other side. Eat clean, exercise, sweat it out, and lots of fruits and vegetables, like I said. It could be part of the normal aging process, but, it also, PMS is very similar to menopause. Women with PMS can get hot flashes. Women with PMS don't sleep well. Why? Well, if you remember from biology, or maybe you don't know, when the woman bleeds, all her hormones are very low. Okay, so then when the bleeding ends, the hormones start to go up. The estrogen goes up, the progesterone goes up, and then mid-cycle, about day 14, she ovulates. Okay, and then they fall again. The progesterone, the only place progesterone comes from is once the woman ovulates, it comes from that little eggshell in the ovary. And that maintains her uterine lining, and it also does so many things for the woman. Keeps her from putting on weight. It keeps her fluid in her body from rising. It keeps her skin healthy and pretty. It does really so much for the woman. So these women that just go on estrogen alone, well, first of all, if you have a uterus, that's dangerous because you could get uterine cancer. You shouldn't do that. If you don't have a uterus, I still recommend you go on progesterone because it's so very... When I went on progesterone, and I'm telling you, I'm a very prolific dreamer. My dreams came back to normal. They're just amazing, and I sleep so well. So it's God's gift to women for sleep, and we shouldn't do one without the other. I'm just saying, no estrogen without progesterone. So as I was saying, women in PMS are very similar to women in perimenopause or menopause. Perimenopause is anywhere 15 years to 5 years before menopause, and the hormones are changing. In perimenopause, the problem is the estrogen levels are wild. They spike way high, then they go way low, and it could be that you're just doing fits and spurts, or it could be that your estrogen to progesterone ratio is off. It could be because, remember I said progesterone only comes from those eggshells? So as we go forward with age, sometimes the little ovary or the egg thinks, well, she's not going to do it. So it gives up sooner. So the eggshells don't last as long, the progesterone drops sooner, and then the estrogen is high. So that's how you get an estrogen to progesterone ratio that's out of whack. And it makes the woman very emotional, and it just doesn't feel good, and you don't sleep well, and you can have, like I said, hot flashes. But what can treat that, the first level of treatment would be herbs, like Vitex. Vitex is a very good herb for women for progesterone. And for men, I often give tribulus. Also for women, if it gets a little worse, I give her progesterone cream in the second part of her cycle. It's from day 14 until she bleeds. And that will support her, and she'll feel like normal until the process progresses. So, and sometimes it de-ages you, and you end up younger, and everything kind of returns to the way it was for a while. So there are many things. You need to go to somebody that's knowledgeable. For men, like I said, tribulus may help them. Also maca, zinc, Vena sativa is a really good aphrodisiac for men. And then because people are giving out Viagra like candy, when what men really need probably is a little testosterone. So you got to do the blood test and see. So women approaching or going through menopause may be at risk for hormonal imbalance, as I said, but there's also the surgical menopause, which is just dramatic. If they have to have a hysterectomy and they take out their ovaries, they suddenly have no hormones. And that menopause is tough. So you need to be ready with those people to treat them and meet the needs of their body because they're used to a higher level. So there's lots of options. There's creams, there's gels, there's troches, which are little things you suck on in your mouth. And, they're dosed in different ways depending, it has to be individualized to the person. But if it gets really bad, I prefer pellets because you put the creams you dose in the morning and your levels go up and down, and then you dose at night and they go up and down. So you're just constantly kind of going up and down and up and down. And it's not as satisfactory as having a level like when you had your hormones, which is really even. And pellets will establish that nice even level, both men and women. For women, for their estrogen and testosterone. For men, for their testosterone. And then for women, we give them a progesterone pill at night. And it returns that lovely, lovely sleep that we all love so much. The other thing that happens to women going through menopause is they get lots of aches and pains, and joint pain, and chronic fatigue, and depression, and sleep problems. And they almost always end up on drugs. Most regular doctors will give them antidepressants, give them opiates, pain medications, and that's not the way to go. I mean, this is not going to make you the best that you could be. You know, if you get back on a little hormones, you won't have those aches and pains and joint problems and chronic fatigue and depression anymore, or sleep problems. So just think about it and realize that there are choices to you feeling balanced and happy. It's your choice. So, you know, do you want to keep eating poorly and not exercising and just let your hormones be blocked by all these chemicals? Or do you want to do it right? You want your hormones to be able to work as long as they possibly can, and then when they need help, we can help them. So, you know, Big Pharma has a play in this. They don't like to FDA approve these natural hormones. You know, the fact of the matter is estrogen has been villainized. The Women's Health Initiative study in 2002 found that a very small number of people got breast cancer. So they stopped their study, which was supposed to go till 2005, because they thought the hormones were causing the breast cancer. And then there was another study called the $1 million or the Million Women study, and the Million Women study in 2003, and it was just so poorly designed that when it was re-examined, the American Journal of Public Health just said, you know, it doesn't even count because we can't possibly tell anything from this study because of the design. But for the Women's Health Initiative study, when they went back and looked at it, what they gave people was synthetic progestin and estrogen that came from pregnant horses. Now, what's used now is bioidentical hormones. Not bioidentical designed in the laboratory, but bioidentical that comes like from a yam molecule and then slightly changed into what's exactly like what is in our bodies naturally. So the synthetic hormones, the progestin and the pregnant mare urine, it's called Premarin, is actually what caused the cancer. Probably primarily the progestin, the synthetic progesterone, and not the bioidentical hormones. In subsequent studies, when they looked at bioidentical hormones, they've actually found that bioidentical hormones not only don't cause cancer, they probably protect us from cancer. So you want to, a lot of doctors I find will tell people, women, when they get to be the age of 60, oh, it's time to go off your hormones. You know, well, why? Because in these other studies a long time ago, they caused cancer in people. Well, yeah, but the recent studies show long-term bioidentical hormones are protective. Not only do they protect you from cancer, but more importantly, they protect you from cognitive decline or Alzheimer's disease. Estrogen actually catalyzes a reaction that makes acetylcholine in your brain. Acetylcholine is the #1 neurotransmitter for memory. And that's why menopausal women will often, or premenopause, say, I can't remember a darn thing. Treat their estrogen if you find that it's low, and they will start remembering right away. It's amazing. So men also have estrogen, and, you know, they need to look into that as well. We watch their estrogen. We don't want it to get too high, and we give everybody, both men and women, if we treat them with bioidentical hormones, something called DIM, which is diiodomethionine, which helps clean out the extra hormones. So it doesn't allow your estrogen to get too high, and it doesn't allow your testosterone to go into the wrong form, which is DHT, dihydrotestosterone, because that's what causes the side effects. That's what causes prostate cancer, that's what causes acne, that's what causes hair loss, and in women a beard. So we don't want any of that stuff. So we take the DIM, which is a natural supplement, and so it's just lovely. It's good, and it also helps get rid of other chemicals in your body. So it's a wonderful system. Again, the FDA would probably prefer that we don't think that these things are good, and that's why they don't approve them. But that does not mean that they are not good. You know, a lot of people say, well, they're not FDA approved, so I'm not going to do it. And they suffer. And they get on these big pharma drugs, as I mentioned. They get on the Ambien for sleep, which is terrible for your liver, and it's addictive. The Lipitor for their cholesterol. Estrogen lowers cholesterol, by the way, and Lipitor causes diabetes. And the makers of Lipitor know that. So it's kind of scary, you know. And also it causes these terrible muscle symptoms, and where a lot of people can't metabolize it correctly. And guess what? Your heart is a muscle. So it's a, you know, I don't think it's a safe drug. If your cholesterol is really off the wall, yeah, you know, take it for a while and then exercise and eat right and get your cholesterol down. The number one cause of a rising cholesterol is industrialized meat and sugar and lack of exercise. So Lipitor in moderation, just for an interim drug, okay. Ambien, I don't like at all. Viagra, it's just covering up the symptoms. They're giving something that's potentially dangerous. A vasodilator, can be dangerous in people with cardiac disease, instead of giving them what they need, which is probably testosterone. And then they put them on antidepressants to cover up their hot flashes, which is nutty because it's just, again, treating the symptoms. Fosamax, because off estrogen, you're going to start to lose your bones. Your bones start deteriorating. So what hormones do, they protect your brain, they protect your heart, they protect your bones. What else do we want, right? So they prevent osteoporosis. And then a lot of people end up on Prilosec. I'm just bringing it up because I think it's a terrible medication, and being a gastroenterologist, before we knew, we gave out a lot of that and all the relatives of it. And Fosamax, all the relatives too. But Prilosec is a proton pump inhibitor, and it can cause kidney problems down the line. Not anything we want to mess with. And it's also somewhat addictive. You take it and then your body really needs it, or you get a rebound reflux, indigestion, burning in your epigastric region. But it cuts out all your acid. Now your acid is how you trigger your enzyme. It's how you digest things. You need your acid in your gastrointestinal tract. You need it. And it's also the first line protection. I know a lot of people that have been on a proton pump inhibitor for a long time, and they get yeast or candida in their esophagus, which is very painful, in their mouth. That's not a healthy situation. So you know, you don't want yeast in your body. It's an immunosuppressant, and so there are natural ways to treat indigestion. You know, ginger is one of them. Artichoke is another one. So, and then Metformin, which is a diabetes drug, but a lot of people get put on it early on for weight loss, or, you know, also and for cholesterol abnormalities and for blood sugar problems. And again, it's diet and lifestyle, exercise, which can lower your blood sugar and get your blood sugar under control. But they get on all these drugs and they still feel sick. So I just explained to you some of the reasons why that might be. So unless you have a family or personal history of female cancer or testicular cancer or prostate cancer, or a personal history of those, bioidentical replacement is good for you. Women should be screened with a mammogram, and men should be screened, their prostates should be screened before starting these hormones, but that's easy to do, and most people turn out negative, and then you can go ahead, and then they're actually protected. And their brains are protected, and their hearts are protected, their weight's reduced, they put on more muscle. It's just a good thing. Their memories improve. And this is another thing. Testosterone helps treat migraine headaches. I think that's fascinating. So, since I got into this, when I get people with migraine headaches, I check their hormones, because maybe we can help them. So just know there are choices for you, and you don't have to feel icky, you don't have to feel imbalanced. Your hormones can be balanced, and you can be happy. Do you have any questions? Hi guys. Thanks for the waves. Well, if anybody has hormone problems or any of those symptoms I mentioned, don't hesitate to DM me on my Instagram or call my office, 818-591-7600. We're exquisite at treating hormones, and we can do it in every way possible and individualize it to your needs. Okay. I love you guys. Thanks for tuning in. If you didn't get a chance to ask your question, please send it to my DM, which means, some people don't know what that means, actually. It means direct messenger on Instagram. Okay? Alrighty. See you next time.